There we go. Hello, everybody. Have you grabbed your coffee for another Coffee and Connect chat? This evening, I'm with my good friend on the other side of the country, way in the big smoke in Dublin, Sinead of On the Pulse Clinics. Hi, Sinead. How are you this evening?
Hello, how are you? It's brilliant to be here, and especially with you, because I rate what you do so highly. It really helps so many people, including myself, because I've watched many of your videos and told loads of people to go looking on your page, recommended your courses. So I'm delighted to be here chatting to you this evening.
Yeah, and I was so delighted that I actually, before this whole lockdown, I actually made it up to Dublin to see you. So I was so enthralled and intrigued by your work and how effective it was. I had acupuncture with Sinead, and I just thought I have to actually share this with you. I love the way the Chinese medicine is integrated in your work, and how in depth you went into the history, that I felt like I was in such good hands. And I was also in awe at your pulse method. So we're going to talk to you more about that this evening. So Sinead, tell us, how did you find acupuncture and how did this all begin for you? Because it's not something everybody goes into from when they're younger. I remember, like, say, when we left school, this wouldn't exactly been on the career choice list.
Yeah, well, when I was in school, I hadn't even heard of acupuncture. So I was practice nursing in Dublin. I originally did general nursing and then went on and did my postgrad in practice nursing. And when I was in general practice, lots of people would come in with things like fatigue or anxiety, and they really didn't want medication, but they were finding that the lifestyle measures weren't making a difference to them. And the other thing that was happening was they'd have blood tests done, they'd have whatever recommended tests that the doctor had recommended done, and the results would all come back as normal, which was fantastic, except the person sitting in front of me is going, but I feel this way and there's definitely something wrong. And I knew that that is exactly how they were feeling. So I thought, there's got to be something else that can help people like that. And I know, and from myself as well, I have had some health issues, and I wanted to find something, I suppose, that could support me alongside Western medicine, you know? And so I found out about acupuncture, which was advertised through a nursing magazine, as it turned out. And I found this amazing man. He's a doctor who was running acupuncture courses. And I thought, that's it. That's the right way for me to go because of his background, because of my background. And he was an incredible teacher and he loved the subject. So when somebody like that teaches you, who's so passionate about it, you can see, and then you see the results that it brings for people. I mean, the passion just grows. How could it not, you know?
Yeah. So that's well, when you see the results, particularly, and without having to fill your body with that medication and go that route, that's obviously a first prize. And tell me, with your health challenges, did you use acupuncture for any personal ailments, or was it through the training you saw how well it works?
Okay, so actually, I got a sinus infection, and I'd had 2 courses of antibiotics, and this infection just was not shifting, and I was just, you know, the way anybody feels when they have a sinus infection, just rotten. And somebody told me that there was a woman that did shiatsu, which is an acupressure therapy. I'd never heard of it, and would I try it? And of course, I was going to try it. I would try anything. And when
I get chronic sinusitis, so I know you will absolutely try anything.
Yeah. So she said to me, well, I'm also an acupuncturist, and would you mind, you know, will you try acupuncture? And I was like, very reluctant because of the needles. And I don't have a huge fear of needles, but I just thought, oh, here, you know, and I quite liked her as well. You know, I just liked her approach. So I said, yes, let's go. And within 24 hours, the infection shifted. And so I thought, okay, there's got to be something in this. And I suppose it was that in addition to what I was doing. And then during the training, literally from week 1, we were seeing clients that came in for acupuncture, you know, case studies. So very quickly, you could see the difference that this could make for people. so in terms of myself and my own health issues, I knew that this was not going to resolve my health issue because it was quite significant. But when somebody is unwell, or when you have a health challenge or a new diagnosis, what's really, really important is that you can feel relaxed, that you can feel calm, because it is so much easier, just so much easier to, I guess, navigate your way through that. And do what you can do for yourself, you know, empower yourself, so that you don't feel completely helpless, and that, you know, you're not going into the hospital where doctors and nurses or whoever is doing tests on you and you're taking medications. It can be very disempowering and very frightening for people. For me, acupuncture was incredible. So I'd go in feeling really stressed, and then I came out and I just felt lighter. And none of the issues had changed. My life hadn't changed. The world hadn't changed, but I had changed. I just felt better. So that's, I guess that was really the most enormous impact that I could see. I thought, okay, this works for everyone, anybody.
Wow. So that was, so on an emotional level, that helped you to feel more calm, more relaxed. And obviously when we're more calm and relaxed, we know that your body isn't in that fight or flight, you know, mode, which decreases and depresses your immunity. And so you heal better, you heal quicker, and you bounce back quicker. So tell me, can I just ask you, on an emotional level then, how does the acupuncture work? Like, to the layman, how can that work?
Okay, so your body makes its own natural anti-inflammatories. It makes its own calming hormones. So biochemicals are basically chemicals that our bodies make, and that goes in your, so that travels around your body in your bloodstream. So your body has the ability to create calming hormones, and also it has the ability, like I said, to create anti-inflammatories. So when you have something like acupuncture, it all works in the nervous system. Your brain is in charge of everything, okay? You see with your brain, you taste with your brain, you hear with your brain. So we think it all happens with the actual organ itself, but your brain is what interprets everything.
Yes.
Your brain is, and tell me if I'm confusing this, okay? So your brain can tell your body to release these anti-inflammatories or to release these relaxing hormones. And for some reason, it's not doing that when you're feeling stressed. So how can you make that happen? So effectively what you do is you put a needle into the skin, insert it in the skin, but you're stimulating a nerve. And we know that when you stimulate a certain acupuncture point, that it lights up a particular area in your brain. And we know this because they've done lots of scans now.
Okay.
And when you light this area up, your brain goes, okay, she needs to relax, and out come all those biochemicals, and it is instant. So the person instantly feels this effect everywhere in their body, and it's incredible. And it's very interesting, because when you're watching somebody who comes in the door and they're like this, and I'm saying, and are you nervous? And they're not nervous. And of course you're nervous, when I get that completely, when somebody's about to put needles in you. But the first needles that I always put in everyone are the ones that release these calming chemicals. And you can actually layer that up. So if the person isn't relaxing with the first needle, you can put something else in, and you see it physically in the person, as somebody's body, just as you can see stress in someone, you see the body physically relaxing. The relaxing part of your nervous system is called the parasympathetic nervous system, which is completely useless for us. But all it means is that part of your nervous system that goes, ah. And this is the part that you want to engage in people. And the sympathetic nervous system is like what you said, Sue, is that fight or flight. Let me run away from this diagnosis. Let me run away from this illness. Oh my God, I can't cope with this. Can I please curl up in a ball? Instead of going, ah. Because when you can do that, then you can be more logical about what's going on.
Yeah.
You can't change.
Your emotional brain hasn't taken over. Exactly. So I get it. Exactly. But no, exactly. That's amazing. And I'd say everybody could do it that.
And you do that. So I just do it. I just use it using the physical body. So some people go for talk therapy. Some people do mindfulness, this is exactly what you do with people.
Yeah. It's just a different way. It's a different
Exactly.
way.
Exactly. I just approach it.
And tell me, actually, what I was going to ask there, when you have used the needles, and we'll go into that in a second.
Sure.
And I know when you use these, the calming response and the effect these chemicals can stay in your body for like hours. Now, when you use the needles, is that the same effect that you'll have that if a person comes for relaxation because they have a very stressful event coming up, right? Yeah. And they feel really relaxed after. On average, or is everybody different? How long does that response last? Or how many sessions one would need for a more prolonged, steady response?
Okay, so it depends very much on the person. It depends on if there has been some, huge event in their life, or if somebody just wants to manage their stress. It's like use it as a preventative. Some people do yoga. Some people don't like yoga, so they'll come to me and I'll pop the needles in. So I have people that come to me, say, for 3 sessions. And then off they'll go and they'll feel so much better. And then they'll come back to me in a couple of months and they'll have another 3 sessions. And then I have other people who are so, I suppose I don't just stick needles in people. This isn't what a consultation is all about. It's very much about the person that's sitting in front of you. And there's talking involved, I mean, I'm not a therapist, I'm not a counselor, but I have 25 years experience in healthcare. I've done lots and lots of different courses, but I've also worked with a lot of people. So listening is a huge part for people coming to see me. And I'm an objective person, not a subjective person. So, it's a confidential space for people. So for sure, part of it is talking. And then the other part is the needles. So it really, really depends on the person. It depends on what they're looking for as well. The average, I suppose, amount of sessions that people will have is 10 to 12 sessions. And that will last a long time. That will last, well, hopefully, my aim, I suppose, for people when they come in to see me is not to keep them coming forever. It's about getting people back on track again so they feel, grounded, I guess. And they feel like they're not going to be overwhelmed in the world out there, or they're not getting overwhelmed by all this news that we're hearing at the moment. Because we're always going to have stress in our lives, and it's about being able to, or feeling like we can deal with it or we can handle it without falling apart. And that's kind of what it's about, I guess, really.
But or turning to unhelpful coping mechanisms, like, if you're like drink or smoking or drugs or whatever it might be, just knowing that there is this other helpful other ways that I can use or access to cope. Can I talk to you about the process? And I know when I went to visit you, you had a very thorough, there's a consultation where I felt very much understood in all the questions that you ask, which is amazing. And I felt like I was home. I was like with the sister who really gets me. And then what I found intriguing was the pulse method you use. So can you tell us a bit about that and the process of a visit for acupuncture? And then we can talk about the needles then.
Okay, so if it's acupuncture only, it depends. So if somebody's coming to me if they've got severe pain, I don't do that big, long consult beforehand. I get them in, I get them on the couch, and we start with the needles pretty quickly, because my aim is to get rid of that pain, and that happens the first time they get on the couch. So once that happens, then I can ask questions. Obviously, you're going to ask, do people have any allergies? Things like, are you pregnant? I usually ask people if they've eaten something recently, because if people haven't and they're low blood sugar or something like that. So these things are important. So safety first, right? But if people are coming to me because they have, say, a chronic health issue, or something that they haven't been able to resolve completely with Western medicine, or they want support with an issue that they have for Western medicine, then I spend the first hour of a consultation I do online now, because it's actually pretty exhausting for people. So I am doing a full medical history. I want to know and everything's confidential, obviously, but I want to know everything that has happened in their life that could have impacted their health to that point. And then you start seeing patterns. The pulse diagnosis, so that's medical history, like with your, you go to see your doctor. The difference is that it's not like you go and see your eye doctor, they just ask you all about anything to do with your eyes, but forget it if you've got something wrong with your foot. I want to know about your eyes, your foot, what you've eaten, what happened when you were 14, you know, all these things are significant. And then people come, I describe what's going to happen, because I never put a needle in somebody unless they feel safe. I don't want to traumatize somebody. I just, I'm not going to do that. And I suppose because of the, I'm losing my train of thought here, because I'm actually jumping all over the place as opposed to losing my train of thought. Just, can you recenter me on the question, the process of the visit?
About taking the pulse.
Oh, right, the pulse.
What that's actually all about, because I didn't know about this, and I find it very intriguing. What's the purpose of testing the pulse?
Okay.
What's the purpose?
Yeah. So when you go to see your GP, they take your blood pressure and they use a stethoscope, right? So, and they listen for sounds. They're listening to the sounds of your heartbeat, if there's any changes in it, what's going on with the valves inside your heart, what's going on with the muscle of your heart. And then they'll take your pulse, and that's really to find out the rate that your pulse is going. If you're very anxious, your pulse rate goes a bit faster. You know, the way you feel your heart beating a little bit faster. Yeah. And another thing that I suppose, it's all these physical signs that you're looking for. If you've got something wrong with your throat, or they're looking at your tonsils, they'll use a tongue depressor and have a look at the back of your throat. If you want to listen to somebody's lungs, you use a stethoscope to see the way air is traveling in and out, right? This is what happens with your nurse and your doctor. And with pulse diagnosis, there are different placements or finger positions on where your pulse is that tells me what's going on in somebody's body. And what I'm looking for is the rate of the pulse, the depth of the pulse, the width of the pulse, the shape of the pulse, all these different things that you can read from the pulse. And we know it's related to a different area in the body. So it's like you're almost starting at the top of the body and going the whole way down. So, do you get headaches? Do you have sinus infection? Have you ever had a concussion? Have you ever had any, trigeminal neuralgia, some like jaw problems? Have you ever had tinnitus? So I'm feeling different things on the pulse, but what it gives me a lot of information to direct my questions to the person that's sitting in front of me. So it's about finding out exactly what's going on for this person, and what the history that somebody's given me, does that correspond to what I'm feeling? Because sometimes we actually forget about things that have happened in our life, and then I'll ask a question when I feel something on the pulse, and suddenly it will trigger a memory from the person in front of me. And then it gives me an awful lot more information for the treatments that I'm doing, and it makes your treatment much more focused. So why or how does that happen? I have to be totally honest and tell you, they've been doing this for over 2,000 years in Chinese medicine, and we do not know exactly how come we can read so much from the pulse. That is the honest answer.
Amazing.
Yeah. Amazing. And it's funny because the first time I saw this, or I saw this, somebody was online, I'm in the acupuncture world and the Chinese medicine world. And there was this guy called Bob Doan, and he was saying he could do this, that, and the other. And he's an American man, and he's lovely. But he was quite, it just sounded amazing. I thought, this is too good to be true, Yeah, so I'm an open skeptic, right? So then I found out he was coming to London, and he was running a course, and I thought, okay, let's go and do the course. Let's see if this is for real. And I was just blown away by the course. And the people that were on the course, and the people, I guess, that he was attracting to his course. So he has an awful lot of acupuncturists and Chinese herbalists, but he also has an awful lot of medical doctors there as well. So, he's very, very smart. And and they say, if you find somebody who's really good at what they do, they're getting results, and they're really smart, these are the people you should follow if you want to get better yourself. Yes. So I started following him, and it turned out he did apprenticeships in his clinic in the States. in his clinic, he sees about 120 people on average a day. And until I went over there, I didn't believe this. So, so I went over, so consequently I went over, and I've done about a month at a time. I've done 3 apprenticeships. I would have gone over this year, except for COVID. Obviously that changes everything. He travels around Europe, and about every 3 months I go and do his courses, because you need to keep these skills in order to improve your skills and to have, you know, to be very good at it. You have got to keep practicing, you've got to keep learning. And so, yeah, so that's why I do that. I do it because it works. It makes
do all acupuncturists use that, or is that a specification or something particular that you use?
This is something very particular to what I use. I'm the only person that has actually gone over and trained with Bob 3 times at this point. Now there are Irish acupuncturists that have gone and done his course, but for me, I have to be honest, until I actually went over to the clinic and started taking loads and loads and loads of pulses and seeing the people coming in, and they're going, so how much, you know, what percentage better are you with this symptom? What percentage better are you with this symptom? Which is what I use with people as well. This is how we measure. I don't just, you know, give people herbs and for them and tell them to come and stay with me and I'll work with you for this many months, with them not giving me feedback and seeing the difference themselves, because that would be unethical to do that. So everything is measurable, and that's, I love that about his system as well. His system works, and I just love that it's measurable for the people that are coming to see me. So,
and that gives you such a greater in-depth vision of what's going on. I couldn't believe when you took my pulse and the things you were telling me, it was like, how does she know all this? I was so fascinated. So that's very, very insightful. And if a person to go that much more in depth, you know, when you want to know what's going on, because we can't always see what's going on. And like you had said, you might have pain in your back, but it could be coming from your shoulder, or, you know, or something with your organs inside that we don't see it all, but you can pick that up, which I find fascinating. And so, so that's amazing. And then sorry,
Sue, I'm interrupting you. I should say things like, you know, I don't pick up things like cancer. I'm not an MRI scanner.
Yes.
But if I pick up things in the pulse and I think, you know what, you actually need to go and see your doctor, that's what I recommend people do. I don't create fear for people, but I always get people to check this out, because the bottom line, or at the end of the day, is I'm taking pulses, you know, and I don't, you know, yes, I get it right an awful lot of the time, but if I'm concerned in any way about that person in front of me, I will send them to a doctor. Or if people come to me and they're worried about something that's really significant that they need to see their doctor about, I am not sending them, but I am recommending that they go and
advising. You know? So can you generally pick up if there is something serious wrong?
You can pick up certain things. Yes. Yeah.
That's, you know, it's really good, because sometimes when people want that second opinion, you know, it could be a nice avenue to go. And I just want to say to anybody who's watching, thanks everybody for joining in this evening. Delighted to have Sinead here. She's a fountain of knowledge and passion for what she does. And if you guys have any questions, please just shoot them into the Facebook feed there, and we will. Sinead, as I said, loves questions and loves being put on the spot. So if there's anything you'd like to ask, please do. This is all about a group chat of sharing and learning together and helping and supporting each other. So thank you everybody who is watching. So please, I'll keep an eye out for your questions. And to move on then to the needles, right? Now, are there misconceptions, or what you would feel is, what people may have a wrong perception or a skewed perception of what these needles are actually like and what it feels like? Because I know when a person thinks needle, they go, oh no, I'm not going there. I know I've had acupuncture a few times, and it's been the most relaxing, therapeutic. Oh, I would choose it over a massage. Like, I mean, you know, really I would. It's just, you can feel the good it's doing, and it doesn't feel like you have needles stuck into you, you know. I can share a picture even of me with Sinead having the needles put in. And my daughter came for acupuncture and she absolutely enjoyed it. It was like a really interesting experience for her. And the in-depth knowledge we got about her that was going on is amazing. And she had needles all over. It was fabulous. And she was fine with it. So tell us a bit, Sinead, about any misconceptions, fears people may have, and you know, sometimes when we listen to other people, you can get a warped idea of what it's all about.
I suppose, well, the first thing to say is that with say if you're having a blood test done, or if you're having an injection, a subcut injection, you know, just under the skin, those needles are much, much wider than acupuncture needles. An acupuncture needle is about the width of a hair on your head, maybe slightly bigger. Wow. And of course there are different sizes, there are different lengths, there's different widths, all those kinds of things. The needling itself is not painful. For some people, the sensation on the nerve feels strange. So obviously, let me just tell you a little story, right? First, a really, really quick story. When I was 9 years of age, right? I went to see a doctor with my mum, and I was having a blood test done. I didn't know I was having a blood test done because he didn't tell me. So he got all his stuff ready and he turned around to my mum and he told her, hold her arm down there. And he proceeded to do a blood test. And I was so traumatized by this.
Of course.
That it really impacted me so much. So the next time my mum brought me for a blood test, I think I was 11, and I literally ran. I just took off. And this was in a hospital setting, and they had to come and find me. And I honestly don't remember if I actually had the blood test on the day or not, but that was purely from trauma. So I swore when I started then training as a nurse that I would never, that anybody who was in front of me was ever going to experience a tiny trauma or a fear or a big trauma from needles that I would put in somebody. And so so for me, so that is just part of me. That is, you know, this is how I approach people. So some people are really terrified of the needles. I can use studs, these tiny, tiny little ones. And I use tiny, tiny little needles in the ear. This relaxes the person. And then I start on the body ones. But I always start on the one that's going to be the most impactful or the most effective for the person. And then depending on the person, we'll put 2 needles in or we'll put 10 needles in, you know, and it's all about this interaction that you have with the person in front of you. The aim is to have that person walking out feeling better, and you don't need an awful lot of needles to do that. Obviously the aim is to resolve the issue as well, but you know, you can do it gently. It's not a very, very frightening procedure or process. So I suppose the other thing to say is that nobody has never ever not come back because of the needles. In fact, nobody's never not come back, but anyway.
Because they feel the effect. And I can say, I don't know if anybody watching has had acupuncture or would like to share their experience. But for me, when you say when you're putting in the needle, you don't even feel that. And when it affects the nerve, if that's the right word, it feels like just a tiny, almost like a twinge, like I don't know how else to put it, but it's just like a twinge, and that's it. It's definitely not sore, and it's definitely not pain in my experience. And it just feels so nice, because how often do we get to just lie there anyway? Like, I mean, what a pleasure. You know, I'm like, come on, give me more. And but also, how long? Does it depend on the person? Also, how long you leave those needles in for?
So if somebody comes into that makes a difference as well. If somebody comes in with fatigue, like extreme fatigue, like they can hardly function or they're very depleted. Say if someone comes into me that has had a lot of treatment for cancer, something like that, and they're just exhausted, you literally leave those needles in for 8 minutes, and that is plenty. So you stimulate their nervous system, which gives you more energy, but you don't deplete the person anymore, because otherwise you're going to send them home exhausted. So if somebody has pain, I'll leave the needles in for longer, because the longer you leave the needles in, the more relaxing it is for the person. And then it depends on how much time I have, how busy I am, and how busy the person is. You know, some people want to get in and out as quickly as possible because they're so busy, and that's fair enough. I understand that. But usually by the time they come for their second session, they're like, no, happy, I'll stay, you know, because it's relaxing. 28 minutes. 28 minutes.
I booked out an hour. I'm staying here.
Yeah. 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 But it should be fun as well. You know, it's not very, you know, it's serious in that I want to resolve the issue for the person in front of me, but it's about having a bit of banter. And, you know, because people are nervous, it's good to laugh. You know, even that releases you know, these relaxing chemicals that we make as well.
And if you know that this generally it works for most people, and you know, why would you not give it a go, really?
Yeah, absolutely. Yeah.
And even there's so many symptoms and issues that we live with and go, you know, daily, that actually we could be having so much of that relief through the odd session of acupuncture. You know, life is all about being happy and feeling good. So, you know, don't suffer in silence. Now, that comes on to one question I also want to ask you.
Yes.
If a person is already taking medication from their doctor or whatever, does the acupuncture in any way affect that?
No, absolutely not. That's, I mean, that's even if somebody is on something like warfarin, it's you know, as long as their INR levels are fine, and the person will know what I'm talking about there.
Yeah.
You can still have acupuncture. If you sorry, warfarin is a blood thinner. There's only one reason. There's only one reason that the doctors don't like people to have needles in terms of bleeding, and that's when somebody's platelet count is really, really low, so their clotting isn't as efficient. But otherwise, it is completely safe. It's so rare. I mean, I've never had somebody come to me that there's no reason for me not to needle them. I also work in ARC. Well, at the moment, because of lockdown, we're not seeing people for acupuncture in there at the moment. But I see a lot of people that are on chemotherapy, that have had radiotherapy, obviously any kind of treatment that you have for cancer, but oftentimes they're on medications for other illnesses or chronic conditions as well. And probably because I'm a nurse, or my background is in nursing, I see people who have, I guess, significant diagnosis, as well as people who are just who are healthy and want to, you know, use this as a preventative method, you know, who want to, you say, increase, you know, relax so that your immune system works efficiently.
Yes.
Or
so at this point in time, it would be good to boost our immunity.
Absolutely, of course it would.
And I mean, lot of issues, if there's anybody has any issues, like things that I'm thinking of, everyday issues, you don't have to have a big issue. So like people who might be struggling with insomnia.
Oh yeah, absolutely.
You know, so the challenges I can imagine right now. And so, struggling to sleep because of stress, maybe emotional overeating. Would it help with things like that?
Of course, I mean, it will help because it relaxes the person, and then there's the talking, you know, and it's not just talking about, it's when I work with people, it's about motivating people as well. It's about empowering people. So it's about giving people tools so that when they leave my room, that they have these tools that they can relax with at home, or, you know, that they can look at their eating, almost observe it in a logical way, and not judge themselves and not beat themselves up all the time. Oftentimes people come to me and they, you know, they're just blaming themselves for everything, and they could have had, you know, some major event could have happened, or they could have huge fear around COVID, and it's just a human reaction. You know, it's normal to have human reactions. You can't be logical all the time. There's an emotional part of us, and it's perfectly normal to express that, and sometimes people don't express that or can't express that. So at least when they come to me, then there's no fear of judgment, and they also feel relaxed, and that makes a huge difference to people changing their behaviors, you know. And it's something that we have to, not just people that I see, I have to work on it on a day-to-day basis. We all do. It's like your physical health. You have got to consistently work on yourself so that you can enjoy your life and live it to the full, and not be kind of not feeling fearful all the time, or not feeling under threat all the time, or just getting out there and having a bit of fun, because even though we're in lockdown, we can still have fun. We can still chat to people we meet at a distance, there's so much we can still do, and it's important that we realize that, I guess. And
absolutely. And if there are these things, like we know, like lack of sleep, if I know, if I don't have enough sleep, I'm not as pleasant as I am this evening. Let's just say. So it really has an effect on people. And then if you're overtired and you're having to work, as we all do, and then suddenly you're like coming home and there's that bottle of wine and you're going to go for it. You know what I mean? And then you can easily go down this route of bad habits, and maybe you start smoking again, having given up for years. And speaking of things like that, would this help with breaking a cycle of addiction or those unhealthy habits that have gotten a grip of us?
So I would say it would certainly help with healthy habits, because I can give people a structure, a plan, and then there's the support for me in terms of making changes. And I think oftentimes people think they can go from really unhealthy habits to, living perfectly, and I do every day perfectly. But it's about step by step by step. It's like, that girl Denise says, step by step we grow. And that's what it is all about. It's putting building blocks in place to in order for you to succeed in whatever your aim is or whatever your goal is. When it comes to addiction, coming to see me, I can't just stick a needle in a person and then, if I'm an alcoholic and somebody sticks a needle in me, I'm not going to suddenly not be an alcoholic or not have alcoholism, as opposed to putting a label on somebody. I apologize. But, you need other help. But I can certainly help with the stress and with the, just to stop your nervous system going into overdrive, and to stop all that cortisol coursing through your body and all that adrenaline, which is what is driving you to, go for a cigarette. And and the hilarious thing about cigarettes is they make your heart beat faster. So you're actually creating more anxiety in your body. And then because that's making you more anxious. And now we have a physical addiction as well to the nicotine. And this heart is still up here all the time. So you have another cigarette and you're keeping yourself up here. And it's just that anxiety it's almost like, and you get used to it. And then you think, this is normal.
That's it. You get used to that feeling, so you don't know what it's like to feel relaxed and well. And so it could be a cog in the wheel of healing and
absolutely,
transformation to the life that you deserve and that you want. So, which is really great. And what I like to about coming to you is it's not just about sticking needles in. You work with a whole person, and you're not just giving them a needle therapy and sending them out the door. You feel very, very supported, mind, body, spirit, emotionally, on every level when you go see Sinead, which is what I absolutely love. And tell us a bit, Sinead, about how then the Chinese medicine comes into this, and the herbs. Do you want to tell us a bit about how did you discover them in conjunction with each other, and how do they fit and marry into the whole acupuncture scene, and how can that help all those people out there?
Okay, so when I suppose usually people will come to see me for acupuncture initially, because people don't know an awful lot about herbs, or you go into the health food store and you buy a herb and you take some drops or whatever. What I do is really, really different. So, I studied Chinese herbal medicine, and then I studied Chinese herbal medicine with Bob as well, in conjunction with the pulse. So what you do is, so there are so many different herbs, right? But what you can do is individualize a prescription, a Chinese medicine prescription, okay? I'm not talking about what doctors prescribe here. I'm talking about prescribing herbs, and you mix up all these different herbs according to the person you have in front of you. So if somebody, for example, so I had a lady that came to me who was burnout. That was her issue. She just felt, she just didn't know where to turn or what to do. And she was overeating, she wasn't exercising. So, and she was in pain. So the acupuncture, really, really useful for the pain. I could support that acupuncture with anti-inflammatory herbs, but also herbs that would make her relax, so that she's less stressed, so that all your muscles relax. Yeah. And then also to, I guess, get blood flow to the area where the pain is, because our blood is, you know, which is what carries all these anti-inflammatories, and all our white blood cells and all the things that we need to heal a certain area in our body. Herbs can do so many different things. And you used to, when I learned initially, you got a ton of things that looked like twigs and leaves and a bit of gravel, and you put them into a saucepan, you boiled them up, and then you strained them and you drank it over the next 3 days. And now it's just so much easier. So the herbs are very much regulated, and all you do is you get a spoon of your herbs, cup of boiling water, let it soak for a little while, and drink it. And that is it. It is so easy. With herbal medicine, you have to be an awful lot more careful. So I would never give a pregnant woman herbs, or people on certain medications. I would never give somebody whose immune system is depleted, you know, people that are on immunosuppressants for things like psoriasis, things like they've had an organ transplant, any kind of some of the autoimmune diseases. Sorry, I'm sorry if I'm getting too complicated here, but an autoimmune disease is something like type 1 diabetes, asthma, just to think about it, psoriasis, I've mentioned already, rheumatoid arthritis, these kinds of things. Right. So if the doctors want that person's immune system depleted, I am not going to give something to somebody that's going to increase their immune system, you know, that's going to strengthen their immune system, because it's going to have the opposite effect to what they need at that time. But then there are other people whose immune systems are depleted because of, for example, stress, and they need their immune system strengthened. And I can give those people herbs so that they'll feel so much better. You know, things like helping them sleep, helping with stress, helping with fatigue. So you help someone to sleep, and obviously then they feel less, you know, they're getting restful sleep, they're getting good quality sleep, good quantity of sleep, and therefore their energy increases.
Everything gets better. Yeah.
Sorry, am I giving too much detail, or am I explaining it?
No, that's super. So it's nice to have the both working together.
Yeah,
you know, the acupuncture and the herbs.
Yeah, yeah. Often, because sometimes acupuncture alone will not work for the person in front of me. For younger people, they will respond really well for acupuncture. So I have, say, young women coming to me who have just gotten married, or they're in a relationship and they want to have children. So their periods might be irregular. So I can regulate their periods using acupuncture and relax them as well, which is, you know, so important. Obviously, actually, and I've had a few people recently that were getting married, and then all the restrictions that are there, and they were really stressed out. So being able to help them to be relaxed, to really enjoy their day, and then we continue on and just regulate the period so they can move on in their life and, you know, do what they want to do.
That's it. And that's something they may have just left, you know, and they wouldn't have enjoyed and have had that, you know, that special time in their lives with as much joy and ease, had they not.
I never would have thought of it, except for this woman, this gorgeous young woman who's a teacher, came to see me, and she saw me, it was like the Tuesday before her wedding. She was getting married on the Saturday, and I'm sitting here going, and you're here for acupuncture? But it was actually one of the best things that she could have done. And she that said it to me afterwards, oh my God, I really enjoyed my day, because even though it was stressful in the lead up to it, she felt so relaxed on the day. And that was 4 days, Tuesday, Wednesday, Thursday, Friday, Saturday, after her acupuncture, her first acupuncture session. So it's incredible what it can do for people. I had
and then what about for menopause, for women going through menopause? Does it help and support that?
It really does. Hugely. Usually for people who are going through menopause, they will need herbs as well. It's not essential. It really depends on, you know, some people sail through menopause. Some people just get, you know, that they can't sleep. They may have just one issue. Other people have huge anxiety, their appetite changes, they're gaining weight, they're I'm just trying to think, they're not sleeping at nighttime, they're getting loads of hot flushes. Those women will need herbs. Acupuncture alone generally doesn't work well enough for them. It will work on their
the herbs you take into your internal, they're internally in your whole system, I guess. What was I going to say? Can you tell, say for a woman with a lot of those symptoms, can you tell from the pulse, say what herbs they would need, or do you just go by their symptoms because clearly they can tell you they're going through it?
Yeah, absolutely. So I guess it's kind of Chinese, it's patterns are what you call a diagnosis in Chinese medicine. And so somebody can come to me with exactly the same symptoms, but 14 different patterns. So this is what the pulse does. It narrows down that. So you're kind of, the history and the pulse together, it all builds a picture for the approach you're going to take for that particular person. So I could have two women that come to see me, both, we say using hot flushes for an example, and both of them have really severe hot flushes, and they will get completely different formulas, but it will work for both of them. So that's how it works. So when people, I work with people, when I'm doing those kind of, I do a plan with people like that. I do a 5-month plan. Nothing happens overnight. This is not magical. It is really powerful and effective, but I don't give people magic. So, so we work together for 5 months. Initially, I see people very regularly, and I'm working with the pulse. I'm listening to the person. What percentage improvement in your hot flushes? What percentage improvement in your sleep? What percentage, and week by week. And the first thing that people will always come back with is they have increased energy, even though the other issues that they came to me with haven't changed as dramatically yet.
So, and who doesn't want increased energy?
Exactly.
To start with, that's a great start. And tell me something though, Sinead. Obviously, say for example, talking about the menopause there again, that can go on for many years, or depending again on the person. But when they stop taking those herbs, are they going to go straight back to where they were?
No.
Or does it depend?
No, the whole aim of the treatment is to at the end of the 5 months that person can go on with also new lifestyle habits, that because I work with people on that as well, and they can then just go on and live their lives, and so you live a healthy lifestyle. It makes a huge difference. But until you can actually see that and the difference it makes in your life, you don't believe that doing that alone can make such a difference. But herbs are not forever. But in saying that, some people love the herbs. So, every so often they say, oh, Sinead, I'll come in for a visit and I'll just, go on herbs for a month, because our lives, things happen in your life, and you could have some kind of a stressful event, or maybe a bereavement, or maybe some kind of a health diagnosis, or it could be anything that happens in the world.
And we're forever changing.
Yeah, exactly.
Our hormones are forever changing. We're forever changing.
Exactly.
So exactly. I'm going to see if anybody has any questions in the meantime of tell us where you're headed. What are your plans? Tell us some exciting news, and where we can get hold of you.
Okay, so I'm on Facebook quite a lot at the moment. I've started doing videos. This month I'm going to be talking about sleep. Next month I'm going to talk about anxiety, and then the month after that I'm going to talk about fatigue and building energy, although we know they're all related, basically. So at the moment, because of restrictions, I'm seeing people who are in significant pain. I can see that people who are very, very anxious about what's going on at the moment. So I'm based in Dunleary, and people can phone me. I think you have my details there. And if not,
I'll add it into a link. Yeah.
The name of my Facebook page is On the Pulse Clinics, or if you put in @onthepulse.clinic, you'll find that Facebook page, and you can contact me through that. I'm on Instagram a little bit. I was on it quite a lot, so there's video there as well, and I just talk about kind of health related stuff, really. What else am I doing at the moment? I mean, I'm doing lots, and I'm also developing tools that people can use to help them relax, exercises that they can do themselves. I've been working a little bit with Sue and another woman called Lucy. I think you interviewed Lucy, Live Life Lightly. And
I did.
Yeah, so and we've been doing
valuable information.
Yeah, but we've been doing a lot of collaboration even, and it's amazing what we can learn from each other and what we can share, and then what we can give our clients. It makes such a difference.
Yes.
But also we practice, we do all this ourselves. We walk our talk, and that's really important. For me, it's important, and with the people I work with, it's really important as well.
Of course, you have to live it, or you don't know how to relate to it. There's a lot of people here who are saying they've had acupuncture and from you, and it was excellent for sinus. Acupuncture very beneficial. There's somebody getting acupuncture at the moment for menopausal symptoms. That's great. Yes, lots of people have had acupuncture, and it sounds like magic. Lots of people tuning in, so obviously it's an area of interest, and who wouldn't want to feel better? And it sounds like acupuncture and the herbs can treat literally so many symptoms that there's no reason to struggle or suffer in silence if you're not feeling great. I would certainly say contact Sinead, because even that first step gets you on that right path to finding your inner happy and feeling great again, wouldn't you say?
Absolutely.
Yeah. And so thank you everybody for watching us, and if anybody has any questions, now is your chance while you have Sinead live in the hot seat, or if you're watching on replay, you can post some questions in here and we will very happily get back to you. And
can I say one more thing, Sue? Sorry, just about the acupuncture that people
absolutely
might find interesting or relevant. So when people, oftentimes people ring me and they have an injury on their back, or they have it in their neck, or they can't move, or they're having severe headache, something like that. I never needle in the area that the injury is. It's called distal needling acupuncture, the type of acupuncture I do. So there's no risk to people of me making that injury worse by creating more inflammation in the area. It's always, the needles I put in are between the elbow and the hands, and between the knees and the feet for everything. So that I just thought that because sometimes, especially if somebody,
very important.
Yeah. So just to take that fear away from people, or
because I had said my daughter had needles all over. I was exaggerating. It literally wasn't. It was, as you said, it was in those areas.
It was in those areas. And well, plus on the head, I do neurological acupuncture as well, or neuroacupuncture, scalp acupuncture as well. So it's so, for people that are afraid of needles, there are lots of different options. You can use the ear, you can use the head, and these are very gentle forms of acupuncture. There's always an option.
Yeah. And one thing actually I just want to say then before we go, we know that inflammation, stress particularly, causes inflammation in the body, and inflammation leads, or chronic inflammation can lead to disease. Is that correct to say? And that acupuncture helps with that inflammation in the body. So it actually would be a very therapeutic thing for somebody to do.
Absolutely.
For that reason.
Therapeutic. Yeah. I mean, we all have stress. It's it's the degree to which you have it in your life and how you manage it. And if you're a person that knows that you're stressed out all the time, or if you just, some people think you get so used to living in that state of stress, if you actually relax your body or check in on your body and just check on your posture and check, are you clenching your jaw? Do you get butterflies in your stomach when you're nervous? Do your neck and shoulders feel tight? All these are signs of stress. Do you get constipation? Do you get diarrhea for some random reason? Do you get pains and you don't know what's causing them? All of these can be caused by stress. So it's really important that we don't ignore it if we do have stress in our life.
Don't accept it as being normal.
She's incredible.
There is good stress.
Amazing program. Sorry, I'm talking over you now. But what you do with people to reduce their stress levels is amazing. It really is. I thought that treating the physical is the most powerful way, to get people to relax, and it is a powerful way. but also doing it the way you do it, with mindfulness and the techniques that you use. It really, really helps people to relax.
Oh, it is. It's huge. And I think that's what, yeah, sometimes people underestimate the power of that because they feel it's too simple. And we all know that most simple things in life are the best. So, sometimes people feel like they need that prescription from the doctor, and they need those rather than, and they want something external to fix them. Whereas learning the tools and techniques, which we have been doing as well, you know, then the power is within you, and you reclaim that control. So there's so many avenues one can go to, and different ones to continually empower yourself and feel great, because life is short. So you want to live that happiest, best possible life you can. And when I get back up to Dublin, I will definitely be coming to visit you again, because it just felt amazing. And I mean that. So, and actually one last question I'll continually keep. We said we had no problem chatting, and we were right. And we could go on forever. But just something that's come to my mind. If one does have a lot of inflammation in their body, would a person know?
Yes, because they'll have pain. People will have stiffness. They'll have, you know, people get up in the mornings and they're feeling a little bit more stiff when they get out of bed. And then, you know, as they go through the day, it's much easier. They have much more ease of movement. That's inflammation. I mean, that is what's causing that. And you need to reduce that down, because if you don't reduce that down, stiffness will lead on to pain. That's what will happen.
So don't just
scare anybody, but it's significant, you know. Other things, I mean, you know, you get lumps and bumps, or you bang into things and you get bruises, and you don't even know why you have a bruise. These are all signs. Your body will let you know all the time that there's something going on, because your body is amazing. It's constantly working on healing you and making your body work in the best way that it can, to keep you alive, to keep you going. It's less concerned about your happiness than keeping you going. And you know, to be in a relaxed state. It's much easier for the body to do its job when we're in a relaxed state.
Absolutely. So that's the bottom line. So chill out and get acupuncture. That's the name of the game. So I don't think anybody has any questions. They say thank you, and thank you everybody for joining us. And I hope you did grab a coffee, and I'm glad you got to connect with us. And I will leave the details of Sinead's On the Pulse clinics, that you can connect with her as well. And I'm quite sure she'll offer you a coffee after lockdown.
Thank you so much, Sue. It's been great.
Thank you for joining, Sinead. Really, it was really lovely to chat.